There are two forms of lupus. There's systemic and there's also discoid with 1082, chapter 34. But Miss Bruna, did you need something? Oh. Chapter 34, page 1082. The discoid form only affects the skin, but it's very rare. So the most common type is the systemic form. Because it's systemic, it's going to affect the entire body, literally head to toe. So what is it? It's an inflammatory, you can add there chronic, autoimmune disorder that affects every organ in the body. Why? Because it affects every connective tissue. So it's a connective tissue disorder. Now name a body part that doesn't have connective tissue. None. Because otherwise we will fall apart. Okay, so what are connective tissues? The skin is a connective tissue. Bones are connective tissues. Blood vessels are connective tissues. Blood itself is connective tissue. Every moving part of the body has connective tissues. So we have the peritoneum, the pericardium, we have the pleura, we have the fascia, we have the joints, the synovium of the joints. Every hair is connective tissue. So everything has connective tissue. So there's no organ. Lungs have connective tissue, meaning the kidney. Is that really all nephrons? No, there's connective tissue there, right? So lungs, same thing. So the trachea, that's connective tissue. So everything has connective tissue. So every one of them can be inflamed in lupus. So imagine the signs and symptoms this patient will have. So we'll look at the picture shortly. We don't know because it's autoimmune. We have no idea what causes it. We have theories, but there's no cure. That's because it's autoimmune. That's why it remains incurable. We can't treat it. That's the best thing we can do. Now, because this is chronic, patient can have remissions. We can also have exacerbations. The number one trigger is stress, which is very subjective. The stress can be physical, emotional, could be environmental. Here are your signs and symptoms. So let's start from the head. So you lose hair, there will be alopecia. The skin manifestation will be a rash, this shape here, right around your cheeks, over the bridge of your nose, shaped like a butterfly. This is what discoid has. Discoid lupus will only have skin manifestations. The rest of the body is spared. You'll have ulcers in the mouth, the bone marrow, because that's connective tissue as well. It'll be affected. So the patient will have pancytopenia. Here, anemia, neutropenia, thrombocytopenia. Because every connective tissue will be inflamed. So pleuritis, pneumonitis, pericarditis. Remember pericarditis last semester? So this is one of the non-infectious cause of pericarditis. So myocarditis, the number one, what have you seen? So what happened to Selena Gomez? She lost her kidneys because of lupus. Okay, so that's the most common complication. So the patient will develop lupus nephritis, which is basically intrarenal kidney injury. So patient will lose the kidneys. There will be lymphadenopathy, meaning your lymph nodes will enlarge, become painful. There's osteoporosis. Remember, bone is a connective tissue. And we can go joints. So the number one complaint of the patient will be joint pain, plus the unpleasant skin rashes, lesions. And what age group is affected? Your age group. Okay, so you are at the peak of lupus incidence between 20 and 40.
How do you get lupus?
Again, we don't know. It's autoimmune.
I mean, like, is it like hereditary?
It can be hereditary, but most likely If you ask a lupus patient about their family history, chances are there's someone else in the family that has another autoimmune disorder, not necessarily lupus. It tends to run in the family, but it's only the autoimmune part. Doesn't mean your mom has lupus, you'll get lupus too. You may get something else. Okay, another autoimmune disorder, maybe rheumatoid arthritis, something like that. So our goal for treatment really is symptomatic management and to put the patient in remission. We want to put you in remission. We can do that because it's autoimmune. What do you think the therapy will be? Okay, so this is what the patients will have to be taking. For how long? For life. Okay. And then of course, same thing if what did we give to the patients who experience acute rejection? Exactly. So either increase the dose or put them on steroids. Okay. So same pattern here. So whatever autoimmune disorder you have, the treatment will be similar. In fact, the drugs used here is not exclusive to lupus. Same thing used for Crohn's disease, any other inflammatory, autoimmune inflammatory disorders. So this is the main complaint. Almost 90% of lupus patients complain of the joint pain. So it can be debilitating. It can put the patient in disability. Okay, the pain, they just cannot work. Okay, it's too painful to move. Fine motor will be affected. Here, joint swelling, tenderness, and that's on every single joint. Hands, your feet, joints, your knees will be affected. And cardiac system, I already showed you, this will cause pericarditis here. And then once you have pericarditis, then of course that can cause heart failure, right? And then all sorts of other complications. Here you lose your kidneys, nephritis, CNS, you'll have neuropathies. You could even develop a stroke. Because this will increase because does it decrease your mobility? Yeah, the joint pain and swelling puts you in a chair or in bed, so that increases your risk of blood clots, and then you get strokes or PE, etc. Yeah, so it's not fun. What's the largest organ or connective tissue in the body? Skin. So number one cause of the trigger for you to go into a flare-up or an exacerbation is sun exposure. So number one, because can we avoid the sun altogether? No, you have to get out at some point, right? So what do we advise the patient to do? Very good. So SPF 50 or better. The book says 30, but do you want to use 30? No, we want 50 or higher. Don't worry, we have sunscreen is only getting better. It's not getting worse. Okay, so the SPF is increasing. So you won't see SPF 10 or 20 now. It's at least 30 or better. So lots of signs and symptoms. Imagine head to toe signs and symptoms. As far as diagnosis, it's not that easy because ANA antibody is positive. However, you remember in rheumatoid arthritis, was it positive also, ANA? Yes, the rheumatoid factor and ANA antibody was also positive in rheumatoid arthritis, meaning is there a specific test exclusively used to diagnose lupus? No, you're gonna have to look at it clinically. So the doctor's challenge is to put all the signs and symptoms together, patient's pattern of the symptoms, and then the lab tests. And then they come to a conclusion that it's lupus. So some of them may be misdiagnosed, for rheumatoid arthritis, for instance, or something else before we get to lupus. So based on the connective tissues, particularly in the cardiopulmonary system, so this can be life-threatening, correct? They don't really die from the lupus, but the exacerbations, okay, which now affect the kidneys, the lungs, the heart. Okay, that's when they get into trouble. So here's the drug therapy. What do you think is the patient's your priority concern by the patient? The pain, right? The pain is what they'll complain of. They could care less about pneumonitis, pericarditis. I'm in pain. Sadly though, what type of pain is this? Inflammatory, correct? Systemic inflammatory. So therefore, can we use opioids? It will not work. Okay, so NSAIDs. And we just concluded peptic ulcer disease. Since these patients will have to be taking on NSAIDs for a long time, what should you give? Yeah, NSAID. So what do we want to prevent the peptic ulcer? Okay, so you either get the PPI or H2 receptor blocker, or what was that abortion pill again? Misoprostol. But what age is these people that are affected? Okay, childbearing age. So therefore, if they have to take the misoprostol, they have to be on birth control. So you're adding pills upon pills upon pills here.
That's a lot.
So here's a expensive monoclonal antibody. This will be given periodically if the patient's insurance covers it, to keep them in remission for a long time. Okay, but then they're expensive. But it depends on what insurance you have. So if you're on this drug, heavily suppresses your immune system, so no live vaccines when you're on them. Same thing for this rituximab. Steroids are only used for exacerbations. Okay. So during exacerbations, we give them high dose steroids, but if they need to take it every day, it'll be smaller doses. But only used for exacerbations. We really don't want to put them on steroids every day for life. You've heard of this, right?
Yeah.
2020, very popular, COVID. Okay, so this is an anti-malarial drug. It works for lupus because this acts on the skin. So here's the action. It's not written here, but the action of the hydroxychloroquine is it decreases the skin's ability to absorb ultraviolet rays. Therefore, if it absorbs less UV light, will there be exacerbation? No. So that's how the drug works. Okay, so that's how it helps lupus patients. And lots of immunosuppressants. We'll look at a few. So anything sound familiar here from what we did from? Yeah, so same thing as with rheumatoid arthritis. And have you seen this also a few minutes ago?
Yeah.
The eyes.
This was also in
That was for the
organ rejection, right? Yeah, so this was also used in organ rejection. How about this one? Yes, we saw this also in the same table, right? And azathioprine, this is again not exclusively used in lupus, but most lupus patients will be on azathioprine. Okay? It's quite popular. It's very effective. So this is their day-to-day.
Why is that?
It's quite effective, right? Plus, it's not that expensive. I would imagine. So let's go to prevention of exacerbations. So sunscreen, very important. Plus the other manifestations, what do we do about the hair? You're losing hair. So Miss Green, if you're losing your hair, is that important to you? Yes, you have very nice hair. You lose all that, so now you're left with just a few clumps here and there. So how can we help you? Plus the hairless scalp. Is that as strong as a regular scalp? I mean, is our scalp really made to be with no hair? No, right? I mean, can it withstand the sun exposure? Do we? Okay, so we have to protect. That's my point. So if the patient loses hair, you have to protect the hairless scalp. Okay, so you put sunscreen or whatever mild products you can apply to protect it, because it's not used to direct sunlight, right? That's why we usually have hair. So it's not built like that.
What are we doing? Putting it out.
So if the patient chooses, we can use wigs, right? So as they're losing their hair, do that ahead. And what's the treatment again for osteoporosis? It's not discussed here anymore. So what are those drugs again we use for osteoporosis? Ibandronate, alendronate, bisadronate. Okay, so what do we call those? Biphosphonates, right? And for biphosphonates, what do we teach the patient again?
To take it.
With
A lot of water.
a full glass of water, and
Just sit up
for how long? 30 minutes. And what time do we give it?
Time I give.
First thing in the morning. Okay, empty stomach.
Oh, I forgot that. We don't need any.
And one thing I forgot to mention is whenever we're giving immunosuppressants or steroids, what else does our immune system help fight against besides infectious organisms? They also kill cancer cells. So if you're suppressing the immune system and they help fight cancer cells, what could you possibly develop? Cancer. Okay, so patients can down the road, because of all the immunosuppression, patients will catch cancer at some point. Smoking also helps prevent exacerbation, meaning it triggers a flare-up. So avoid the sun, no smoking. Because let's talk about sexual activity. So this is 20 and 40 years old. So while they're on immunosuppressants and all of these, so what do you think their sex life is going to be?
Not good.
Terrible.
All right, can they conceive?
Oh, no.
Okay, probably they can, but because I know several people with lupus, they have 3-4 kids. Okay, but the problem is with the pregnancy. Can it trigger a flare-up?
Yeah.
Yes, pregnancy is stressful, correct? What about the labor and delivery? That's even more stressful. Well, it doesn't really make a difference, because during pregnancy, that's when the
But Professor,
Your body is going.
they're using this patient use metoprostol, so they will have to stop.
Yeah, of course, yeah, they have to stop the misoprostol, and then you can still use NSAIDs, but now use PPIs and H2 receptor blockers. Anyway, so the evidence shows that there's really no difference. So let's say this patient gets pregnant. Evidence shows that whether they terminate the pregnancy or carry the baby to full term, they will get a flare-up anyway. So it doesn't make a difference. So it's the it's the patient's choice if they want to terminate the pregnancy, and because it doesn't really matter. If they terminate it, they still go on a flare-up anyway. Or if they carry it to full term, they still have a flare-up.
Wouldn't it be worse if they carry?
True, but again, makes no difference. So, but again, it's all the patient's choice. Yes.
So is it more aggressive in women than men?
Yes, more females. Good point. More females are affected by lupus. We do have male lupus patients, but more women. More like 4-to-1 ratio.
More stress.
Okay, por eso
That's about it. So the main thing here is the sunscreen, okay, skin protection. When they go out, what time of the day would be best to be out? So avoiding what time period?
The midday sun.
Okay, 10 to 4, right? That's the hottest time of the day. So avoid being out, maybe 10 to 2, something like that. 10 to 4 would be better. So early morning and then late evening would be the best to be out. There's still sun, right? You can still be at the beach at 4. Yeah, and less people too. Yeah, because most of the people are drunk already, right? So they're not in the water anymore. Okay, I think we got it.